Responding to seizures, a step-by-step guide. Emergencies can happen anytime, anywhere. Recognizing and responding effectively to a seizure can save a life and make a real difference. In this video, we'll walk you through step-by-step what to do when someone experiences a seizure, how to stay calm, and ensure their safety. First, let's understand what a seizure is. A seizure is a sudden, uncontrolled electrical disturbance in the brain. It can cause changes in behavior, movements, feelings, or levels of consciousness. There are two main types of seizures: generalized and focal. Generalized seizures involve the whole brain and can cause convulsions, muscle rigidity, or brief lapses in awareness. Focal seizures affect a specific area of the brain and might result in unusual sensations, repetitive movements, or confusion. While seizures can be alarming, most last only a few minutes and aren't life-threatening. However, prompt and appropriate action is crucial. So how do you recognize a seizure? Common signs include sudden collapse or falling, uncontrolled jerking or twitching of muscles, loss of consciousness or awareness, staring blankly or confusion, unusual sensations or repetitive movements. Remember, every seizure is unique. Some might be subtle, like brief lapses in attention, while others are more dramatic. Understanding the signs is the first step in providing help. Your calmness can reassure others and help you respond effectively. Assess the environment. Ensure the person is in a safe space away from potential hazards like sharp objects, traffic, or water. Gently guide them to the ground if they're not already lying down. Place something soft, like a jacket, under their head to prevent injury. Move objects away that could harm them. Use a watch or phone to time the seizure. Most seizures last 1 to 3 minutes. If it goes beyond 5 minutes, it's a medical emergency. Never try to hold the person down. Let the seizure run its course. Avoid putting anything in their mouth. The belief that they might swallow their tongue is a myth and can cause injury. Once the seizure stops, gently roll them onto their side. This position helps keep their airway clear and prevents choking in case of vomiting. Stay with the person until they are fully alert and oriented. Speak calmly and let them know they are safe. While most seizures don't require emergency medical attention, you should call for help if the seizure lasts longer than 5 minutes. Another seizure follows immediately. The person has difficulty breathing or regaining consciousness. It's their first seizure. They are injured during the seizure. The seizure happens in water. Keep these special considerations in mind. Look for a medical alert bracelet or necklace. It might provide vital information about the person's condition. If the person has a known seizure disorder, they might not need an ambulance unless it meets the criteria we just mentioned. For pregnant individuals or those with diabetes experiencing a seizure, seek medical help immediately. Allow the person to rest. They may feel tired, confused, or embarrassed. Avoid giving them food, water, or medication until they are fully alert. Provide reassurance and stay with them until they feel stable. If the person doesn't fully recover or seems confused for an extended period, seek medical attention. Preventing injuries during a seizure is just as important as responding to one. Here are some tips. Educate yourself and others about seizure first aid. Encourage workplaces, schools, and communities to have seizure response training. Support individuals with epilepsy in creating safe environments. Emergencies are unpredictable, but your quick and informed response can make all the difference. By staying calm, following these steps, and knowing when to seek help, you're not just responding to a seizure, you're providing hope and safety. Share this video to spread awareness, and let's create a more informed and compassionate community together.